Hello, this is Sebastian Sattui with the University of Pittsburgh, and this is my QD clinic for today. So last week, a 64-year-old patient with a diagnosis of PMR came to my clinic for a second opinion. She had not been seen by a rheumatologist prior to this. And interestingly, her diagnosis of PMR had been done a year prior in the context also of a concomitant workup and eventual diagnosis of a renal cell carcinoma. So her PMR presentation was clear prolonged morning stiffness, shoulder and pelvic girdle symptoms, no peripheral arthritis symptoms at that point, with pretty kind of significant elevation of her inflammatory markers, and patient was started on prednisone 15 with a quick improvement of symptoms. Parallelly, diagnosis of renal cell carcinoma was done, and the patient was underwent surgical excision. There was no evidence of any metastatic disease, and since then, disease has continued to be in remission. And despite attempts to taper prednisone, again, diagnosis over a year ago, every time steroids hit kind of 5 milligrams or below, symptoms quickly recur. Even more so for the past months or so, even doses of 5, 6, 7 have actually persisted. And upon us meeting, what she told me was, I haven't been able to comb my hair for 3 weeks. However, her inflammatory markers have been normal, and both her oncologist and her primary care, who, under my impression, had kind of thought of this also being as a paraneoplastic presentation, were concerned and saying, well, why are your symptoms not coming back, are so persistent if your inflammatory markers are normal and your malignancy is actually under remission at this point? A patient on exam had elevation of her arms, both up to only 60 degrees bilaterally, had significant pain on both sides, had actually some mild tendonitis of her left wrist, also inability to stand up and limitation and pain with flexion at her hip level, also pain of palpation bilaterally. This scenario of PMR as a paraneoplastic presentation is certainly not uncommon. It is something that we certainly usually consider, and especially when assessing a patient with new onset symptoms that are concerning for PMR, we always need to keep in mind to check for other constitutional symptoms and always keep malignancy under our differential as well. However, in this patient, the malignancy had actually been addressed. There was no concerns for any recurrence of disease. However, her PMR symptoms were persistent, and she had clear persistence of symptoms characterized again by pain and stiffness. If someone tells you that they're stiff until 8 p.m. and that's when they finally see a little bit of movement and then they go to bed and the next day starts again, it's where active disease needs to be considered. At that point, with inflammatory markers being normal, as much as we sometimes, of course, rely on this, they're certainly not bulletproof, as we know, and the patient presentation and exam and findings are what are more consistent for this. It would have been interesting, although this was not done, PET scan as well, that was done, not that could have been done as well for remission, although this was not, there were not findings in this patient, assessing for PET scan uptake in the shoulder and pelvic in the hip region could also be used for assessment of active PMR. There are other findings as well as the dorsum of the hands or interspinous processes, but these were not available for the patient. But again, the clinical picture primed overall, patient was started on higher dose of steroids for looking for symptom improvement, and given the fact that this was already 1 year on glucocorticoids with persistent symptoms, there was going to be a discussion about steroid-sparing agents as well, considering both either CST-MARTs or biologic treatments. So again, always to keep in mind, PMR can present as paraneoplastic, but it can be also concomitant. Again, we're talking about an age group where malignancy can occur, but the fact is that it can continue to have symptoms and affect patients even in the absence of and complete remission of the malignancy. And inflammatory markers being normal, but a patient who's still stiff and painful will will still point to disease activity. So with that, I hope you have enjoyed this case. And again, listen to the patient's not only inflammatory markers. Take care.